Now this patient has presented with severe acute pain in the right hypochondrium and the epigastric region, and what we see is this is the gallbladder. And this is the anterior wall of the gallbladder. Here you see a thin ring of fluid around the posterior segment of the anterior wall of the gallbladder in longitudinal section. There are calculi within it. This is a calculus, this is a calculus, this is a calculus. Now the largest of these calculus measures 15.9 or 16 millimeters, and this is a case of perical cholecystitis or acute cholecystitis due to 16 mm calculus that is impacted in the GP neck region. This is the longitudinal section, and you can see there are multiple calculi within the lumen of the gallbladder. These are the calculi within the lumen of the gallbladder. This is not the bowel, and this is the IBC, and there is no evidence of intrahepatic bile duct ectasia, whereas एक लंबा साल है कि साल हो गया साल हो बाजी ज़रा लंबा you see that the gallbladder is not distended as it is usually seen in case of pancreatic pathology or GP outlet obstruction. So this is the fluid line, rim, gallbladder, and these are all calculi within the lumen of the gallbladder. This is the transverse section of the gallbladder, and here you can see the number of multiple different sized dense coarse echogenic areas within the lumen of the gallbladder, with the neck and the lower segment showing fluid around and with no dilation of the common bile duct. This is the portal vein. This is the pancreas, the sacidium. This band of white tissue is the pancreas. It's normal, not affected. And here we see the gallbladder from a different angle. Here we see you can see that the lower half of the anterior wall is edematous. There is fluid rim around it. This is the portal vein. This is the common bile duct. So these are not dilated. This is a case of acute cholecystitis with pericholecystic fluid.